Good afternoon, and welcome to the second meeting of the Study Committee for Guidance on PFAS Testing and Health Outcomes, convened by the National Academies of Sciences, Engineering, and Medicines, Board on Environmental Studies and Toxicology, and Board on Population Health and Public Health Practice. PFAS, or per and perfluoroalkyl substances, are chemicals with almost ubiquitous exposure in the United States. Considering the vastness of this exposure, it's difficult to know who, when, how, and what to test, as well as the risks of testing, if any. The National Academies are undertaking this consensus study to provide advice for clinicians about PFAS testing and how test results should inform clinical care. Additionally, our expert study committee will examine the health outcomes associated with PFAS exposure and will develop principles clinicians can use to advise patients on exposure reduction. You can learn more about the study by viewing our online video and the statement of task for the study on our website. The objectives for this meeting today are to hear presentations, discussions, and public comments by Eastern US. I'm sorry, I'm hearing somebody's voice. So I'm sorry. The objectives for the meeting today are to hear presentations, discussions, and public comments by Eastern U.S. community members impacted by PFAS, to learn how the National Academy's consensus study guidance on PFAS testing and health outcomes would be useful to impacted communities, and to provide a forum for committee members to ask questions about community impacts and concerns. I would now like to read our disclaimer statement for public sessions. As chair of the Committee on Guidance on PFAS testing and health outcomes, I'd like to welcome everyone to our first town hall and our second meeting. I want to note this is an open, on-the-record information gathering session. That is, the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions, and that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the academies. Now, for those of you not familiar with the committee process, this is the second of several planned public committee meetings. In the public sessions, we'll have the opportunity to hear from many experts in the field and to receive public testimony. The committee will deliberate thoroughly before writing its draft report. Moreover, once the report is written, it must go through a rigorous review by experts who are anonymous to the committee. And the committee then must respond to this review with appropriate revisions that adequately satisfy the Academy's Report Review Committee and the chair of the National Research Council before it is considered a National Research Council report. The expected report release is spring of 2022. For more information on the study, including future meetings, you can find this on the project website at www.nationalacademies.org/our work, separated with a hyphen, /guidance on PFAS testing and health outcomes, all separated by hyphens. During panel discussions, the moderator and committee will ask questions of the speakers. If you're viewing on the web, the questions and comments made in the chat box will be made available to the committee after the meeting. This is so we can hear comments and perspectives from everyone and keep on task in the structure of the meeting. The meeting is being recorded, and the recording and available speaker presentations will be posted to the project website soon after the meeting. At this point, I'd like the committee to briefly introduce themselves with their name and affiliation only in the interest of time. I'll start with myself. I'm Ned Kalange. I'm the president and CEO of the Colorado Trust and affiliated with the School of Public Health and the School of Medicine at the University of Colorado. Laura?
Thanks, Ned. Laura Anderko from Georgetown University School of Nursing and Health Studies.
Thank you, Laura. Erin?
Hi, Erin Bell from the University at Albany School of Public Health, Department of Environmental Health Sciences.
Thank you. Dana? Moving on, Kevin.
I am Kevin Elliott. I'm a professor at Michigan State University and a member of their Center for PFAS Research.
Thank you. Melissa.
Hi, I'm Melissa Gonzalez. I'm a professor at the University of New Mexico School of Medicine.
Thank you. Jane.
Hi, I'm Jane Hoppin. I'm a professor at North Carolina State University.
And Brian.
Hi, this is Brian Lind. I'm an occupational environmental medicine physician at Yale School of Medicine.
Thank you. Marc Andre.
Hi, I'm Mark Werner. I'm a professor at the University of Montreal School of Public Health.
And Veronica.
Hi, I'm Veronica Vieira. I'm a professor at the University of California, Irvine.
Thanks, Veronica. Shaiben.
Hi, my name is Xiaobing Wang. I'm a professor at the Johns Hopkins School of Public Health and School of Medicine.
And Chris.
Hi, my name is Chris Wyatt. I'm the recently retired president and CEO of the Caring for Colorado Foundation, health funder in Colorado.
And I want to let the audience know that Tamara James Todd and Alex Kemper, both members of the committee, will be joining a bit late. Now I'd like each staff member to briefly introduce themselves, starting with Elizabeth.
Hi, I'm Elizabeth Boyle, and I'm a senior program officer at the National Academies, and I'm the director of this study.
Thanks, Liz. Rose.
Rose Martinez, I direct the Board on Population Health and Public Health Practice.
And Cliff.
Hello, I'm Cliff Duke. I'm the director of the Board on Environmental Studies and Toxicology.
Marilee.
Hi, I'm Marilee Shelton Davenport. I'm a senior program officer with the National Academies.
Cesar.
Cesar Raymond Segovia, program assistant for the National Academies.
And Alexandra.
Hi, I'm Alexandra McKay, and I'm a senior program assistant with the National Academies.
Thank you all. Sorry.
Sorry, Ned. And then I think a couple committee members that are on might have got missed somehow. Erin Haynes, Veronica Vieira. If you could introduce yourself.
They introduced themselves.
Yes, hello, I'm Erin Haynes, and I am professor and chair of epidemiology and preventive medicine and environmental health at the University of Kentucky.
And we did get Veronica, right?
Okay. And then I think Kaylee also didn't get a chance to introduce herself.
All right, Kaylee.
Hi, everyone. I'm Kaylee Bynes. I'm National Academy staff and associate program officer with the Board of Environmental Studies and Toxicology.
Is there anyone else I've missed? Thank you. The structure for our agenda today involves 10-minute talks by each of our invited speakers, followed by a panel discussion. Committee members can ask questions via the raise hand function during the panel discussion. When the panel sessions are done, we will then close with public comments.